Life keeps us in perpetual motion, and for as long as our bodies can carry us, we can keep living life to the full, and we can keep doing the things that we love doing each and every day. But for many, as time goes on, living life to the full becomes much, much harder. 40 years ago, a breakthrough in medical science happened right here in the city of learning and discovery, Oxford, and has since allowed hundreds of thousands of people all over the world to carry on moving. In the 1960s, two men crossed paths right here in Oxford. One, a consultant surgeon at the Nuffield Orthopaedic Centre, and the other, a lecturer in engineering science at the University of Oxford. They were John Goodfellow and John O'Connor, and together they would change the course of medical history with the invention of the Oxford knee.
So I met John Goodfellow in 1966 and we began this collaboration. There was really no well-established knee replacement available. The devices that were available, most of them were demonstrating one if not two problems. Either the surfaces wore out very quickly or the components loosened, fell out, as it were, or both. So our objective was to create a device that, first of all, would treat the patient's pain, would not wear out, would not loosen, and would restore the patient's function. That's what we hoped we would achieve.
O'Connor and Goodfellow's breakthrough was considered so important to the medical sciences that it featured in an exhibition of great medical discoveries here at the Bodleian Library of Oxford University in 2014. For people suffering with crippling knee conditions such as osteoarthritis, the Oxford knee was a real game changer. Before the Oxford knee replacement implants had a tendency to wear out, primarily because the plastic bearing used to replace the worn out cartilage was fixed in place. The great idea was to make the bearing mobile, so when the knee bends and extends, the bearing slides back and forth, spreading the load and reducing the wear and tear on the knee. The mobile bearing had another key benefit. It allowed the knee to twist from side to side, just like a normal healthy knee, allowing the recipient to have a greater range of motion. In June 1976, the first patient received the Oxford knee, and in the 40 years since, procedures have taken place all over the world, including here, Nuffield Health, Oxford, the Manor Hospital.
So this is today's patient. He's a 57-year-old gentleman. This is looking at his medial condyle, and you can see the white area here is bony edema, and there's an area of significant collapse right down in the lower part of the femur. The first step is obviously the incision, getting down to the inside of the knee. For 90% of all partial knee replacements are on the inside of the knee between the femur and the tibia, and you retain the cruciate ligaments, and all the other structures are normal.
That is really why the knee functions so well after an Oxford knee. So the second major step in the development of the Oxford knee was to use it just as a partial or uni-compartmental knee replacement. Now, having realized at the beginning that the Oxford knee was rather difficult to do, I became interested in trying to improve the surgical technique and the instrumentation for the Oxford knee. But reflecting on the 40 years research, I think the most important thing is that patients have been followed up in detail, and it is based on identifying the problems that we've been able to provide solutions.
Patients with minimally invasive surgery can recover twice as fast as surgeries performed with the standard open knee incision, which was much bigger, with eversion of the patella, and they can recover 3 times as fast as a total knee.
I was in such pain I could hardly walk, even with a stick, that facing even a distance of 300 yards was like facing a marathon. And I can't imagine my life going on with the increasing level of pain. So I've had 2 very successful operations, and I've got my life back.
So the next step in the story was when we introduced the cementless components. But we have found with the cementless components, it's much easier to implant the components, and the fixation is better and the results are better. So the Oxford knee we consider to be a definitive knee replacement, and we would say that 90% of patients will have good or excellent results and won't need a revision. And I don't know of any other knee replacement, either a partial or total, that's achieved such good results.
After 40 years of research and development, the Oxford knee is like so many of its recipients, only getting better with age and refusing to slow down. And with the innovation that's driven that development still going strong, it's likely that future recipients are going to be back to their feet and back to doing the things that they love doing faster than ever before.